So we're going to talk tonight about erectile dysfunction and blood pressure, two things that are incredibly important. My name is Lentz, and I've been working at Duke now for 12 years. These are my disclosures. So I think this is one of the slides that if you don't remember anything else I say tonight, this is a good one. And that is newsflash. What's good for your heart is good for your penis. And I say that somewhat jokingly, but I'm also very serious about that. The things that we should be doing for ourselves anyway, like, trying to maintain a healthy weight, maintain a healthy blood pressure, prevention and management of diabetes, getting a good night's sleep, trying to minimize stress and anxiety in our lives, not smoking, not abusing drugs or alcohol. All of those things are good for your heart, and that in turn is good for your sexual function and everything else. So I think that's one thing I want everyone to take home or take to heart, that literally what's good for your heart is good for your penis. When we think about erectile dysfunction, what we're really talking about is someone who cannot achieve or maintain an erection that's sufficient for sexual intercourse. And it's dependent on a lot of different things, and there are different ways to classify it. You can classify it as psychogenic, and that would be sort of, related to things like stress and anxiety, depression, decreased sex drive, things like that. It can be neurologic, from, let's say, a spinal cord injury, from Parkinson's disease, multiple sclerosis, Alzheimer's, things like that. It can be hormonal, so maybe low testosterone. Arterial, that's one of the things that we're going to talk about tonight, and that's just not getting enough blood flow into the penis. And then it can be venous, and that's when too much blood flows back out of the penis, and I'm going to explain how that works in a couple slides. So if you think about the way the penis is built, this is how I describe it to patients. The penis is really just one big tube, and inside of it, you have three smaller tubes. Now, I'm going to use my mouse. I don't know if you guys can see it, but my cursor is on the urethra. That's the small tube that you urinate through. And then you have these guys. These are called the corporal bodies or the erectile bodies. And the way things are supposed to work is when you become aroused, you become sexually stimulated, you have an increase in blood flow into the penis. As the blood flow increases, the pressure inside of the penis increases as well, and it gets so high that the little veins that normally drain the blood out, those become compressed, so blood's getting in, but blood can't get out, and that's how you maintain the erection. And one thing that's really important here are these little cavernosal arteries. So the arteries on both sides, you have one on the right and one on the left. That's what primarily brings the blood into the penis. And those same small arteries, they're about the exact same size as the arteries that supply blood to the muscle of the heart. So whenever you hear the term small vessel disease or microvascular disease, things like that, that basically means clogging of those arteries. And there are a lot of things that can do it. High blood pressure is a common one, diabetes, uncontrolled cholesterol, things like that. All of those can cause microvascular disease. And it also just happens by age alone. That's why it's so important to take good care of ourselves as we get older. I'm not going to go through this in detail. I just sort of mentioned this, but again, a lot of things, the point of this slide is that a lot of things have to go right for you to get a good erection. You have to have normal neurologic sensation. You have to have a normal endocrine system. So you have the hormones that you need to have sex drive and have a libido. And then you have to have all of the blood supply issues, blood getting into the penis, not so much blood getting out of the penis, in order to maintain that really good erection. And again, this is sort of an example of what things look like. You can see over here on this side, in the normal stage, this is when you're not erect, all these little channels are small. There's not a lot of blood in there. And then when you become erect, these channels dilate, they get bigger, and that allows the blood to rush in and subsequently for you to get the erection. So I think one thing that's really important to think about is how common erectile dysfunction is. I think a lot of people don't realize how common it is. And if you look at the statistics of men over the age of 40, about half of men over the age of 40, 50% of men over the age of 40 are going to have some form of sexual dysfunction. So after the age of 40, if you have some form of sexual dysfunction, whether that's difficulty achieving an erection, difficulty maintaining an erection, or decreased interest, things like that, you're in the majority. It's very common. And if you look at the risk factors, not surprising, some of the most common ones here are things like high blood pressure, high cholesterol, diabetes, and smoking. And then there are lots of other things as well, like alcohol abuse, drug abuse, trauma, depression, obesity, all of those are risk factors. But the big one we're going to focus on tonight, which is probably one of the most common causes, is elevated blood pressure. And again, if you classify erectile dysfunction, you break it down into psychological problems, neurological problems. So those are problems related to the nerves, the spinal cord, the brainstem, hormonal problems. And then you have the ones that we're really going to focus on, the vasculogenic. So vascular system, meaning your arteries and your veins. And again, hypertension or increased blood pressure is a very common cause. Unfortunately, some of the medications that we use for elevated blood pressure can also cause erectile dysfunction. So if you add up all the different causes of erectile dysfunction, if you look at the statistics here, about 40% are vascular and about 15% are medication. And so quite honestly, if we consider hypertension or high blood pressure is probably the cause of most of the vascular causes, it's a good percentage of the medically induced causes. You know, over half of all erectile dysfunction is in some way related to how well you control your blood pressure. Now, I point this out because it's very important to know. If you guys have ever heard the old phrase, the canary in the coal mine, you know, back in the day, the miners would take these little birds down into the coal mine with them. And if the bird died, then they knew, hey, I better get out of here. There may be some type of toxic gas that I'm breathing and it could kill me. And so that became an analogy for an early warning sign. We know that erectile dysfunction is a strong indicator of vascular disease, and it's an early warning sign for the risk of having a heart attack or a stroke. And in fact, men with erectile dysfunction have almost twice the risk of a heart attack as men without erectile dysfunction. So yet again, another incredibly important reason to control your blood pressure. Not only do we want to prevent the secondary effects of high blood pressure, like retinopathy, erectile dysfunction, kidney failure, etc., but we also want to reduce the risk of having a heart attack. So if you look at the numbers, and now this is a small study, it's only 104 patients, but if you looked at men who are classified as having high blood pressure between the ages of 34 to 75 years, over 2/3 of them reported erectile dysfunction, and almost half of them had severe erectile dysfunction. And what was most interesting in this study is that the degree of erectile dysfunction was not really related to side effects of the blood pressure medicines that they were on. Although we're going to talk about that, blood pressure medicines can affect erectile function. In this specific study, the high blood pressure alone was enough to cause erectile dysfunction, regardless of what medications they were taking. So drug-induced erectile dysfunction, and these are the ones we're going to focus on. So beta blockers. Beta blockers have been around forever, and they're used very successfully to help treat high blood pressure. And you may have been on one of these drugs like metoprolol, atenolol, labetalol. They've been around forever, and they work really well. Unfortunately, they potentiate this activity in the penis, which actually causes some of those blood vessels and some of those spaces to clamp down instead of expand, leading to erectile dysfunction. Another drug that's incredibly successful for blood pressure management are thiazide diuretics. So those are things like HCTZ. We're not exactly sure why it causes erectile dysfunction, but multiple studies sort of indicate this, and patients should always be counseled that it's a risk. Unfortunately, what a lot of patients do is if they have a side effect like erectile dysfunction, they simply stop taking the medication. And that's not a good thing, because there are alternatives that your doctors can talk to you about. One in particular that we know about is losartan. That has not been shown to have the same side effects, as well as calcium channel blockers. Those have also been found to be a little bit safer. But again, As a patient, you're not expected to know that. If you have side effects, though, like for example, you're started on hydrochlorothiazide HCTZ, you should talk to your physician and ask them if potentially there's an alternative that may not have the same side effect. So what can be done if you develop erectile dysfunction? So again, first and foremost, we want to look at first-line therapy. And the big thing with first-line therapy is that you want to take care of yourself. And again, you should be doing all the things that are important anyway. Getting a good night's sleep, getting regular exercise in your diet, trying to reduce stress and anxiety, managing your blood pressure, managing your diabetes, managing your cholesterol. If you smoke, you should try to stop smoking. If you drink a little too much, you should try and cut back. If you have depression, if you have anxiety, you should look at treatment for those disorders. And then the next step are usually the medications. So lifestyle, drug therapy modification, psychosocial counseling and education if necessary, hormone replacement, and then lastly, the oral medications. And I'm going to go through those briefly. So if you look at the drugs that are currently approved, most everyone has heard of Viagra. Most everyone has heard of Cialis and Levitra. Another one that's on the market is called Stendra. It's never been marketed very much. These drugs used to be extraordinarily expensive. At one point in the past, a single dose of Viagra or Cialis could have been as expensive as $30 or $40. Unfortunately, these days, that's not the case. You can get generic sildenafil for as cheap as 20 cents a pill, and generic Cialis as cheap as $10 for a full month's prescription. And in a lot of men, these are successful. How these primarily work is to relax the smooth muscle inside the penis to allow more blood flow to come in. One of the things that not every guy understands is that sexual stimulation is required. You're not, just by taking the medication, you're not going to walk around with an erection. And patient education is very important. Patients should try the maximum dose of the medication until they're considered a failure. If you have a big meal or a glass of wine, a beer, it will decrease the success of these drugs. They will not work as well if you eat a big meal before you take them. And it's also really important. They work better if you're treating the other conditions at the same time. If you're managing your blood pressure, you're exercising regularly, you're reducing smoking, these drugs will work better in that situation. The second line therapies, those are things like vacuum pumps, penile injections, urethral suppositories, and penile implants. And I'm not going to go into a lot of detail about these, but I do think it's good for you guys to know what's out there. The old-fashioned vacuum pumps, these have been around for 50 years. Unfortunately, they don't honestly work that great. It doesn't require a medical therapy or surgical therapy, but these can sometimes be somewhat cumbersome to use. A lot of men can achieve an erection, but it's difficult to maintain the erection. And insurance doesn't usually cover these anymore. They used to, but about 10 years ago, they stopped. You have penile injection therapy. So in this case, you actually inject the smooth muscle of the penis with a small needle. It's sort of like an insulin syringe. This tends to work okay. Unfortunately, it has a risk of priapism, which is a prolonged erection. It also has the risk of forming scar tissue within the penis. Unfortunately, the medication is usually not covered by insurance. But for patients who have failed the oral medications like Viagra and Cialis, it's a reasonable option. These are drugs that you would need to talk to your urologist about. Typically, once you fail the oral medications, you're going to see a urologist for this. There's also something called a urethral suppository. This is a small pellet of medication that goes inside the urethra. Again, it's not used that commonly. This is specifically for men who don't like giving themselves the injection, or who maybe have a contraindication like a bleeding disorder, and so they can't do the injections. And then last but not least, you have the penile implants. Penile implants have been on the market for almost 50 years now. Overall patient satisfaction with these is quite good. About 90 to 95% of men who get an implant say they would do it again and they would recommend it to a friend. The one drawback is it is a permanent solution. So once you do this, there's no going backwards to the oral medications, to the shots or something like that. But these can be a really good option for the right candidate. And so again, I didn't want to spend a whole lot of time on a prepared talk. I would love to have more interaction from you guys and answer as many questions as I can this evening. But just to remember that, first of all, if you develop erectile dysfunction, don't feel like you're alone. This is an incredibly common disease, and it's more common in men who have high blood pressure. There are very effective treatment options, but you need to talk to your provider. And sometimes I know that's hard. Sometimes I know it's sexual function and intimacy is such an incredibly personal thing. It can be very difficult to talk to a physician about it. But there are experts who specialize in this and can help you. Also remember that sexual dysfunction can be a signal of other serious diseases, such as a risk for heart attack or stroke. And again, bottom line is, take care of yourself. If you have a problem, if you have a side effect, talk to your doctor, because they are very effective treatments for this problem. And with that, I would welcome any questions you have. I would love to hear from the audience, from the gentleman in the crowd, what questions you might have.